continue the exam with a musculoskeletal exam, so this will include inspection and palpation. There's no percussion and auscultation. So we're going to inspect all joints for any redness, swelling, any deformity. We're inspecting for any cracking upon movement, any hitching, looking at any redness, any tenderness that's elicited with palpation, warmth of the joints. So we can go ahead and start with a back assessment and cervical spine. So Nancy, if you want to go ahead and stand up, if you would please. I don't want to get out of the camera too much here, but so if you just turn to the side. So I would be inspecting the spine, starting with the cervical spine, and so we'll have you just face this way. So I'm inspecting the spine here, and then we would want to have Nancy go ahead and bend forward if you're able to then. And so I'm visualizing that as she's moving forward, noting the alignment, and then go ahead and stand back up. And then we would do some tests of range of motion, so you can go ahead and shimmy to the side, and then the other side. Okay. And then lean back as much as you're able. Excellent. Excellent. And we can do some side bends as well, so you can go ahead and bend. Excellent. Great. Thank you. And then hop back up on the exam table. And we would further assess the shoulders. So this will include the sits muscles, which are the supraspinatus, infraspinatus, subscapularis, and teres minor. So we're inspecting the joint, and we would inspect it with just passive range of motion, so I'll just move your arm around. And then it would be active range of motion, so her ability to do that without my movement. And then against resistance would be another test that we could do. So like, for example, you could bring your arms in front of your chest and then push out. A couple tests we could do for rotator cuff tear would be the drop arm test. So I'll have you just go ahead and raise your arms up over your shoulder, and then your ability to slowly lower them. Excellent. And then bring your hands out in front of you, and then as if you were emptying a can. And that's a smooth movement for you. If you want to go ahead and lay back, we'll inspect the hip. So we'll continue with the hip assessment, and to mention, we also want to be aware of overall muscle strength and grip strength. So as you move to each joint, you want to be grading that on a scale of 1 to 5 for ability, her muscle strength. Like for example, if you were to raise your thigh, okay, and then turn out. Her ability against resistance, and you'd grade them on a scale of 1 to 5. So for the hip joint, we can test if you want to go ahead and bring your legs up and out, and bend it out at the knee, and then internally rotate. And you can also be feeling along the joint for any crepitus. We would move, and we would want to further inspect the knee, and there's a bunch of special tests, so what I'm actually going to do is just read through them, and you can read along on your handout, and then we'll perform them individually. So the first would be the balloon sign. So you want to be pressing against the suprapatellar pouch, and you're noting any fluid accumulation. And I can read it exactly as it says. Compress suprapatellar pouch with one hand, with the thumb and finger of the other hand, and feel for fluid entering the spaces next to the patella. Then there's the McMurray test, which tests the medial and lateral meniscus. So the patient's supine, grasping the heel and flexing the knee. Cup the other hand over the knee joint with fingers and thumb along the medial joint line. From the heel, externally rotate the lower leg. This tests the medial meniscus. So when we externally rotate, we're testing the medial meniscus. And then you're going to push along the lateral sides. The pressure is going along the medial meniscus, and you're straightening. And then it would be the other side, so we would rotate internally, and we would press out, just putting the pressure on the lateral meniscus, and we would straighten. Valgus stress is when you push stress medially, so like valgus, valgum, gum sticks your knees together. That was one of the ways people in my class remembered it. And then varus stress is when you push the stress laterally. So those are tests in and of itself, the varus stress test and the valgus stress test. And those, instead of testing the meniscus, are testing the medial and lateral ligaments. So push laterally on the medial side, testing the varus stress test with one hand, and pull medially at the ankle with the other hand. That will open up the knee joint. And then the valgus stress test is simply the reverse. And you're noting any excessive movement of the knee joint. So also, we can make sure the patella is tracking appropriately and that there isn't a compensation or a deviation because of a ligament problem. So Nancy, I'll have you go ahead and just flex your knee. Okay, and I can track the patella underneath my hand and then extend. Excellent. And there's also a level of inspection that goes along with this. You want to make sure that everything is moving smoothly. Then there's the Lachman's test. So you're grasping the distal femur with one hand and the proximal tibia with the other, placing your thumb on the joint line, and you're going to just move back and forth and make sure that there isn't excessive exertion of the ligament, which would show an ACL problem. There's also another test for ACL, the anterior drawer test. So I'll just have you go ahead and bend your knee, placing my thumbs here. We're going to kind of draw out like it's a drawer, noting any excessive movement, and then the posterior drawer test for PCL is simply the reverse, pushing the drawer in. So also an acceptable way to do the drawer test, the anterior and posterior drawer test would be to actually sit on her foot. So I'm going to kind of obstruct your vision here for a second, but it would just be simply like this, so she's not able to move her foot. So if you want to sit up, Nancy, probably a little dizzy. And then we'll just continue with ankle assessment. So I'll have you just go ahead and rotate your ankle, okay? And then I'll have you rotate it clockwise against resistance. Okay. And inspecting the joint at the same time, looking for the redness, swelling. It would palpate as you rotate it for any crepitus, looking for any locking in the movement. And so we'll just have you go ahead and rotate it as many ways as you can. Excellent. So we would want to make sure we dorsiflexing and plantar flexing. And Nancy does have a previous injury here, so there's a little bit of a limited range of motion. So this is the ankle drawer test, so you're going to push down and forward, and then push up and back. Ankle joint. You want to make sure you're stabilizing the ankle when you're doing those tests.